try to refresh my page.
All right, I'll tell you if I see it.
Okay. Yeah, my computer.
It says live, so I think we're working.
Okay, good. I can't read the comments, so you're going to have to do that if that's okay.
All right. Yeah, we're live.
Okay. Hi, this is Sara from Women After 50. I'm so excited and sorry for the glitch in timing, but I'm here today with our first ever interview in 5 years. This is Dr. Anthony Youn, America's foremost holistic plastic surgeon. He is also author of The Age Fix, one of my new favorite books that I lent to my neighbor and my sister and my mom. So I can't recommend him enough. And he's going to go forward and answer questions. Just so you guys know, the way I found him is I was watching PBS one day, and I was so impressed with his ability to talk to women about self-esteem and also make suggestions from your kitchen or from products we can all afford to look better. And of course, surgery if necessary, but only when necessary. So here he is, Dr. Youn. Thank you so much.
Now, somebody commented that there's no sound. Let me just see if I'm hearing it.
Okay.
Yeah, just one sec.
Suggestions.
No, it's coming through. Yeah, it's coming through.
Okay, I can't see it, so.
All right, so thank you so much for having me on, Sara. It's definitely a pleasure to be here. And I mean, the patients that I see the most in my practice are all mainly over 50. And the great thing about it is for every one patient who has actual surgery, we probably have about 30 to 50 that don't have surgery, and they're undergoing non-invasive or minimally invasive treatments. And so what I love to do is see people who are improving their health, who are taking care of their skin, who are turning back the clock, and they're feeling good about themselves as they get older. Because I strongly believe that, I mean, a woman who's 50 can be just as attractive, if not more attractive, than a woman who's 25. And it really is about how you carry yourself. It's about how you take care of yourself, and confidence too.
Okay, great. These questions are coming in fast. So you guys, please.
All right, let's see.
Dr. Youn's going to take the questions from his phone because I don't have my glasses on to read them. But
well, so far everybody's talking about having sound, so that's good. Everybody can hear us.
I'm glad you guys can hear us. But the questions you can ask are pretty much anything he approaches in this book, which again I recommend, The Age Fix. He approaches diet to look better, for your skin to be better, age spots, crow's feet, nasolabial folds, anything you can think of with skin.
So while we wait for a few questions and stuff, why don't I just start by giving what I call my 2 minutes, 5 years younger skincare routine. So awesome. One of the things that people always wonder is, you go to the store and there's all these creams and stuff out there, and what works well to turn back the clock? What do you have to do? Should you do like a 12-step system? The Koreans, and I'm Korean, they do like 9 steps in the morning. Well, you don't have to do that. So if you're watching this today and you say, look, I want to take good care of my skin and I want to do more than what I do, what can I do without spending a ton of money? First thing you got to do is every morning, cleanse your skin and get an appropriate cleanser for your skin type. And you don't have to spend a ton of money on that. Definitely you can save your money. Second thing that you have to do in the morning is apply an antioxidant serum. Okay, so an antioxidant, what that does is it fights free radicals. So during the day, what it can do is really fight off all of the damage that the pollution and cigarette smoke and automobile exhaust and all that stuff that attacks our skin. Put an antioxidant cream on your face, and that's going to protect from that. And the most common antioxidant is vitamin C. And the vast majority of skincare companies have some type of a vitamin C cream. I recommend, if you can, try to go organic, try to go something natural. If you can't and you can't spend the money on it, then just get one that you feel from a maker that you trust and that feels good on your skin. And then the next thing is you want to apply a sunscreen or a sunblock, okay? And have to apply that in the morning, protect your skin, especially the skin of your face. And that's all you have to do in the morning. You cleanse, apply an antioxidant serum like vitamin C, and then some sunscreen or a sunblock. And then at night, you cleanse your skin. Super important. You got to cleanse your skin at night. You got to get rid of the day's worth of grime and pollution and dust and oil that develops and all that makeup. You got to clean it out, clear out your pores, get your skin to be able to breathe. Second thing, after you cleanse your skin, is you want to apply an anti-aging serum. Okay. And the one that I would start with, if you're not sure what to go, is get a retinol serum or retinol cream. And the vast majority of skincare companies have a retinol cream. If you ask plastic surgeons and dermatologists around the country, what's the one anti-aging ingredient? If you had to pick one, the vast majority of them would pick a retinol or Retin-A. And then if you want to apply night cream after that, feel free to do that. However, if you don't want to and you'd rather not, then that's fine if you don't need it. If you've got oily skin, then you don't need a night cream. And then the final thing is 2 to 3 times a week, or maybe once a week if you've got sensitive skin, exfoliate your skin. And you can do that using an exfoliating scrub. You can do that doing an at-home chemical peel. Just make sure you don't get a black market one off the internet. Or you can even do that with like a Clarisonic type device. But you want to exfoliate your skin to get it to turn over. And that's 2 minutes in the morning, 2 minutes at night. You keep doing that, you're going to be way ahead of the vast majority of people, and it's not that expensive.
One thing I want to throw in here is after this broadcast, if you go to Dr. Tony's page and like and comment on one of his posts, he's going to choose 5 lucky people to win the book. So 5 of you are going to get the Age Fix for free just by going to Dr. Youn's website, which we'll put in on a link after this broadcast. Now I can see people are asking what this broadcast is. This is Sara. I created Women After 50 5 years ago. I've never had a podcast. I was terrified about today. Of course, we had a technical glitch, but I was so excited to share Dr. Youn with you because he's so allied with what all of us think. We want to look better, but most of us don't want to get surgery, can't afford products, and he recommends something that we can all afford, even recipes from our kitchen. So please ask questions and he will answer them right now.
So R. Anderson says, Sara, you rock.
Oh, thank you. I can't see anything. I don't have my glasses on.
That's so okay. So Susan asks, and I can do this here. Susan says, is this about looking younger? Yeah, it is about looking younger. It's about looking better. And then let's see.
Your
Chris
best.
Says,
your best.
Oh God, yes, exactly. How to wash your face and be young again. Oh God, how to wash your face and be young again. So, so there's a lot of things that you can do short of obviously having surgery. And when people wonder, well, what are the things that you can't get without surgery? And the simplest thing, 2 things to keep in mind. Okay, and this is where I don't want you to, let's say, waste your time and money and stuff. Is if you've got a lot of loose hanging skin, then unfortunately that's where the non-surgical things aren't that great with, or especially if you've got loose hanging skin of your eyelids. I mean, unfortunately, there's no cream you can put on your eyelids that are going to take care of that. Pam says, grow old gracefully. Totally agree. I mean, these types of things.
That's why he's
surgery is only for that small percentage of people who want to take those steps. But the vast majority of people, really, it comes down to health. And what I'd love to do is give just a few suggestions diet-wise that can definitely help with slowing down the aging process, because it really is true that what you eat can really impact how quickly you age. So a couple of things, if you don't mind, and I know this is your show, so at any time you tell me stop talking
No, I want you to do this. If you see questions, answer them. And just to the person who said that thing about aging, we all age, we're all okay with it, but all of us want to look our best. And one of the things I liked in his book, he said, when you're taking a picture, if you put your tongue on the roof of your mouth and you have some loose skin here, it actually picks it up a little bit. These are just little tweaks to feel your best and not go crazy. Nobody here wants to go crazy.
Yeah. And what I tell my patients, I think the way that I look at it, and as I'm getting older, and obviously I'm not over 50 yet, but I'm getting there, is the first thing is that you've got to consider, number one, is that getting older is a blessing, because what's the other alternative is not getting older, and we don't want that. So getting older is a blessing. And so every day, I thank God that I'm on this, this green earth, and that you can see the sun and the sky and hang out with your friends and your family. But at the same time, looking in the mirror sometimes as you get older isn't the most fun thing. So you know what? It's a blessing to get older. But hey, if you want to fight it every step of the way and you want to have fun doing it, because these procedures and treatments can be very fun. Not surgery, but some of these other things. Somebody asked about different like chemical peels and facials. By all means, do that, because those things will help you heal your skin. It will help turn back the clock. Barbie here says genetics plays a huge role. That's true, but you know what? There is this thing called epigenetics and nutrigenomics. And these are these ideas that, yeah, genes will play a role in how quickly you age and your health, but you have control over a lot of these genes. And how you live your life can impact how your genes express themselves. Okay. And that is super important to realize. Just because your mom or your dad aged prematurely or they've got loose skin, that doesn't mean you're going to get it. Okay. Because you can control this by your genes. It's the same idea that we see with healthcare now. You even say, yeah, my dad had a heart attack when he was 55. So that's going to happen to me. So I'm just going to do whatever I want, eat whatever I want. No, you have control over that. If you control your diet, you exercise, you decrease your stress, you don't smoke, then you can live a lot longer because you can control your genes. And it's the same thing with aging. Sandra says, thank you. I'm really enjoying this podcast. So that's really nice.
Hey, Sandra. So you were going to talk about the food. And I know the number one thing you talk about is sugar.
Yeah, so the number one thing, if you're saying, okay, look, I feel like I'm aging prematurely, I take care of my skin, what can I do with my diet? Number one thing is decrease the amount of sugar that you eat. And it can be as simple as if you're the type of person that you're addicted to Coke and you have 3 a day, then just take 1 out a day starting out and have 2 a day, okay? If you are, if you like desserts, don't take seconds, just start by taking 1. And those simple little steps can make a huge difference. And the way that sugar ages us is 2 things. If you eat a lot of sugar, you get sugar spikes, and that creates insulin spikes. And these insulin spikes create chronic inflammation. Okay, so that's one way. The other way is a process of glycation. The actual sugar molecules will attach to the collagen of your skin and can deform that collagen. And that can cause your skin to age prematurely. So decrease the amount of sugar you eat by decreasing the amount of desserts, by decreasing the amount of soda pop. I mean, soda pop, actually, studies have shown that if you drink a lot of soda pop, it will shorten your life. It's crazy. Decrease the amount of soda pop. And the other thing that a lot of people don't realize is that switching from refined carbs to whole grains, whole wheat, that type of thing can also slow down those sugar spikes. And so eating white rice, white bread, white pasta, that also will create those sugar spikes like eating regular sugar and desserts can do it. If you switch over to whole grains, ideally if you can go with sprouted grains, okay, it's even better for those people who are a little sensitive to gluten. Sprouted grains are great because you keep the fiber in that grain and it slows down the digestion and you don't get those sugar spikes.
I'm going to ask the question because this is my problem, and I know you have this in the book, but I know a lot of you guys have it too. My background is English, so if I go in the sun for 10 minutes, I'm going to start getting spots. And I know you address that in the book. There's a million ways to address these age spots that we all get. And so some of your recipes, like one recipe. Yeah,
so with spots, actually, what I would recommend, I mean, there are some things that you can do. One of the things that can help is it's licorice, actually, licorice drops. But the problem with that is it's slow. And so if you really want to get things going quickly to get rid of age spots, the quickest thing technically is IPL, intense pulse light treatments. And that's if you have access to a med spa dermatologist. It's not painful, super easy. It may be a couple $100 at the most per treatment usually. And you'll see those dark spots turn darker and actually slough off. One of the things I do on my Facebook page is I try to give little tips of what I think are the best bangs for your buck. And one of the best bangs for your buck, in my opinion, is IPL. And that's to really target those dark spots. But if you don't have the money to pay for that, you don't have access to that, you live elsewhere, then there are other things that you can do. And if, one cream that is super effective, but it is a little bit controversial, is hydroquinone. So if you can, a 4% hydroquinone cream is the most effective cream to reduce dark spots. But you only want to do it for 6 months at a time. And for those of you who are concerned about toxicity and stuff like that, there is controversy regarding hydroquinone. You don't have to do that. You can try more like a kojic acid cream or a kojic acid serum or one with niacinamide. And usually those you can buy over the counter. They're pretty easy to get a hold of and they're usually not too expensive.
Okay, let's see if anybody's got questions down here.
We've got a lot of questions.
Just be happy as you are. You guys, we are happy. We're just trying to look our best. There's a big difference between walking around the world sad all the time. I don't think any of us are doing that. It's just optimizing what we have. So let's get one of your recipes for a facial. I know there was one with egg whites.
Yeah, so actually what the easiest thing to do, and the great thing is you can do a lot of this on your own, okay? So egg whites are always good for tightening, but the easiest way to do it is to get actually fruit juices. And so you can get apple juice, you can get lemon juice, you can mix it with a little bit of honey and just apply that type of mixture to your skin. And what those juices have in it is basically citric acid. It's like an alpha hydroxy acid peel, but it's very mild and you can put it on your skin and it helps to exfoliate your skin. You do that, you let that sit for about 20 minutes and dry off. And then you gently wash your face with some warm water and your skin's going to feel much smoother afterwards. Another thing, if you're looking for kind of a nice at-home treatment, is instead of using cucumbers on your eyelids, try using green tea and potato slices. Okay, so what you do is you steep some green tea, you put it in your refrigerator and get it nice and cool. Then you chop some potato slices and put that in the green tea, dip it in, and you can even let it sit for a few minutes, and then take those potato slices out and put those over your eyes. That's much better than cucumber because the starch in the potatoes will actually act as a mild skin lightener, and the green tea has antioxidants in it, which are anti-aging, and it also has caffeine, and that caffeine can also help to tighten up that skin temporarily. So you can get so much more benefits with a potato and green tea over your eyes than just plain cucumbers.
And I want you guys to know too, another thing in this book is makeup tips on just shading your face just to look your best. If your nose is too wide, how to shade it and contour, just like on YouTube. But there's so many things in the book.
And there's a couple of questions real quick, Sarah, about hair loss. Now, hair loss is and it happens to a lot of people. And so if you've got hair loss issues, the first thing you want to consider is stress. A lot of people, there's something called telogen effluvium. This is a condition where people have stress. It causes their hair to fall out. The number one thing you want to look at first is, are you stressed out? And if you are, definitely seek therapy because that can really, really help the situation. If, however, that's not the case and it's falling out, you're seeking therapy, stress isn't an issue, you can talk to your doctor about potential deficiencies, and there are certain over-the-counter supplements that can really help. One that's real popular now is called Nutrafol, and I haven't had experience with it. I do have a friend of mine who's a big-time hair expert. I interviewed him on my podcast recently, and Nutrafol is definitely one of the big ones. Obviously, we know about biotin. That's great for your hair as well. However, if those aren't doing it, and it's not a nutritional issue, then the next step, and this is great, would be low light laser devices. Okay, so low light laser is great. It's completely non-invasive. You can buy what's called a laser cap, and it literally looks like a baseball cap, but on the undersurface are all of these lasers that will actually penetrate the surface of your scalp and cause your hair follicles to go into a growth pattern. And these are scientifically proven to work. You know, it's not surgery, it's non-invasive, completely non-invasive. The first one of those you may have heard of is the laser comb, where you've seen the video, the ads where you comb it through your hair. Well, they have much better ones now that you can put either as a helmet or as kind of like a strip over your hair, and it can and that definitely works. So for those of you who are watching and you're wondering about hair loss, start with stress. Look at nutritional deficiencies, and if that's not doing it, then try low light laser therapy because that does work for a lot of people.
Does that work even with menopause? Because a lot of us with menopause see hair loss.
Yeah, you can try that. I mean, that's definitely more of a hormonal issue. Definitely, I would try that because it could have.
What's your opinion on Rogaine?
Rogaine's great, but you have to get women's Rogaine. Okay, so it's men's and women's are different strengths. And I think that Rogaine definitely can help. And that's something, you can do a lot of these things at the same time. Try the Nutrafol, the biotin, add the Rogaine, try the low light laser therapy. All those things I think are very, very reasonable and great effective ways to help with hair loss.
Okay, any other questions, guys?
One question actually somebody brought up is green tea. And one of the things that I put in the HFix is the benefits of green tea. So another simple switch that you can do that can definitely slow down the aging process is if you're a coffee drinker, and let's say you drink 3 cups of coffee in the morning, skip one of those cups and try a cup of green tea instead. Okay, now coffee is actually good for you because it does have a lot of antioxidants, but the antioxidants in green tea are much more powerful than the antioxidants in coffee. So I would switch to that. Plus with coffee, a lot of people add a bunch of garbage to it, unfortunately. Flavored creamers and sugar and all the stuff that's terrible for you. And you can take which is something good for your skin, a cup of black coffee, and you cause problems by adding all the stuff to it. So trying to switch over to green tea over coffee is definitely going to be good for your skin.
Nails and cuticles.
Nails and cuticles, that's something that I'm not a complete expert in, so I don't want to speak out of my place. One of the two things real quick that I don't treat are hands and the private areas. So
okay, hands, I've got ones, my cuticles, I use Burt's Bees lemon butter cream, and it's under $5, and it really keeps your nails kind of supple. And I would also take supplements. My sister takes something called BioSil, which I think is biotin with something else. And that's really helped her. And vitamin D is good for most of us. Most of us are deficient in that.
Yeah, definitely look into that, because that's something, and I've got a lot of friends in the healthcare space, who really monitor that. And it's amazing how many people are deficient. And that's kind of the difficult part of it is vitamin D, you need to get sun ideally to have that if you're not taking a supplement, but sun also obviously prematurely ages you. So I recommend really is moderation, I mean, you can't completely stay out of the sun. You shouldn't. I mean, it's therapeutic. I live in Michigan, and man, in the wintertime, you get sun come out and it's just therapeutic to go out there and have the sun on your face. I understand that, but it's too much sun. It's worshiping the sun and getting so much excess UV radiation to your skin that really can prematurely age you. And you obviously, you've got a very light complexion, so you know what that feels like.
Yeah. And one of the things I learned from your book was I underused the sunscreen because I just did a very light coat, and I think you said you need 2 teaspoons or something.
Yeah, and it depends obviously on the size, but the thing you want to keep in mind too, some of the, everybody knows, you got to wear sunblock if you're in the sun, but there actually is a difference between sunblock and sunscreen. And what I mean by that is sunscreen is chemicals, and these are chemicals that absorbed into your skin, and it can potentially go into your bloodstream. Sunblock is a physical blocker that sits on top of your skin and blocks the sun's rays from getting in. As an adult, the negative about sunblock is that it is thick, and a lot of people find that it creates this kind of whitish type of a film, like a coating type of thing. And it doesn't look so good. So what I usually recommend for my patients is for your face, if you want to use a sunscreen, by all means do that, because it's a lot lighter and you can put makeup on it and stuff like that. For the rest of the body, if you're at the beach, ideally try to use a sunblock, because there are certain substances in sunscreen that can be hormone disruptors, and you definitely want to use sunblock on your children. Okay, so children and grandchildren, sunblock, you want to use something that has zinc oxide in it, and you don't want to use some of these other substances that are sunscreens on the kids, because they don't need these hormone disruptors getting into their skin.
I use one called Think Sport. It's on Amazon, and it's really lightweight and smells good as sunblock, because I have those concerns. And somebody put forward that if your nails are going thin or you have problems, that can show nutritional problems or illness. Yeah. I agree. Whenever you have a change in any physical part of your body, consult your doctor to make sure your health is okay. If you need blood work, whatever. After that, though, approach it, from the products that you can use.
Yeah, no, definitely. There are certain things, you can actually get skin cancer underneath your nail. And there's been a number of people talking about thyroid, and thyroid issues, definitely something that's a hot topic now in women's health, especially as we get older. A good friend of mine wrote a book called the Hashimoto's Protocol. I have it right here. And
my sister has Hashimoto's.
Yeah, it's right here. It's a huge seller. She's a good friend of mine. It's the Hashimoto's Protocol. So this is something definitely, if you've got issues with your thyroid, I would strongly encourage you to take a peek at this book. She's a PharmD. She's a doctor of pharmacology. And definitely that does, I think thyroid does affect, I think, more with women's health than we realize. And so getting up to speed on that. And the great thing is you can affect it a lot of times with just diet and supplements.
Right. Let's see.
All right, let's see. So
castor oil for hair regrowth.
Yeah, and here's one, coconut oil. Coconut oil, is that good for a lot of things? Definitely coconut oil, super hot topic. Coconut oil, especially, it's a lot of saturated fats. Is that good for your health? Is it not? There's a lot of controversy there. But should you apply coconut oil to your face? And this is something I've gotten a lot of questions on lately. I just saw a patient today who said, and it was a man actually, and he said, all I do is I put coconut oil on my face. And I thought that's actually not good, because coconut oil does actually clog pores. And so you can actually clog pores with the coconut oil. So coconut oil is great if you want to put it on your body, other types of uses, but I would not use it as an actual moisturizer for your
I
face.
have a question because the other night I didn't have any eye makeup remover and I used coconut oil and it worked. But what is like something natural that you can take your eye makeup off with, or isn't there anything?
With makeup, I usually, for me, I would go more for getting an all natural cleanser than trying to use something necessarily from your kitchen. Now,
Okay.
oil cleansing is very interesting because there is this idea about oil cleansing that you can use an oil because it's an oil and it mixes better with the oils on your skin. You can actually clean your skin better. That actually originated in Korea. In South Korea, they do this oil cleansing ritual that people do, and they swear by it. I actually have not tried that yet. But that is something that a lot of people are doing nowadays. And so, but what I recommend if you're gonna, look for a cleanser, the good thing with cleansers is that in general, you can get a natural one that's pretty inexpensive where you want to, and so you can get one that's good that you don't have to worry about. It's the other things where you start spending more money on the actual treatment type things.
I was going to ask you a question, but it just went out of my mind.
One person asked, where do you get my book? It's on Amazon. It's called The Age Fix.
And if you're lucky, you'll win one today because five people will go to Dr. Youn's website.
Yeah, so go. It's I'm on Facebook, so we'll put a link here, but it's Facebook/Dr. Youn, DrYoun, and every day we do a daily video, anything from in surgery to in the office. We try a lot of little different things. Yesterday, actually, we tried it's a tape that you can put on your eyelid to make your eyelids look more open. And so we tested it out on one of my employees and we got some pretty nice results. We also test out different types of skin creams and peels and masks and stuff like that. I
watched that with your employee yesterday. I saw that one.
Oh, yeah. And
you also, in your book, you recommend, like for people who don't want to get Botox and are working on lines, frownies.
Yeah, so that's an interesting thing. They're called frownies. And so they're basically like little tapes that you can apply. And the idea is muscle control. And so it's not creating those wrinkles by training your muscles to not flex. And so you wear these frownies at night, and it's kind of like splinting those wrinkles open so that you don't create any issues with wrinkles as time goes on. Here's a question that actually a very good one. What is good for a double chin? Okay, so common sense tells us that if you've got a double chin, there's nothing you can slather on your chin that's going to make it go away. Really, a few years ago, the only thing we had, yes, the book is The Age Fix. Yeah, you can find it on Amazon, but we're also giving away 5 free copies if you follow me on Facebook. What is your name, Dr. Youn? It's DrYoun. And just leave a comment. Let me know that you found me here on Women After 50, and we'll enter you into the drawing. And we'll put all the links here, obviously, afterwards. But okay, so what was I talking about? Oh, double chin. So a few years ago, all we would say is you can lipo it. Well, that's not, that's surgery. And the great thing now is we have a treatment called Kybella. It's an injectable substance. Very simple. We do it in the office. Literally, the injections take 3 minutes. And you can inject it into the double chin fat. It actually will melt that fat away. It does take anywhere from 2 to 4 treatments, but it really works great to melt that fat away. And we've got this new treatment now called Sculpture. And one of the hottest things now in cosmetic treatments is reducing fat without surgery. And so if you're the type where, man, I work out, I'm in great shape, and I just have these stubborn areas of fat that my mom gave me or my dad gave me, how do I get rid of it? Sculpture it's a laser it's a 25-minute treatment. The laser will target the deep fat cells to actually destroy them. And it does take anywhere from 6 to 12 weeks, but you lose, after one treatment, upwards of 24% of the thickness of your fat. So that's kind of the hottest thing now, is kind of getting rid of fat without actually having surgery, without needles, without any of that stuff.
I got a question. For people whose face is too thin like me, what about fat injections?
Yeah, fat is great. And that's one of the newest things. And the great thing now we're finding is that fat is chock full of stem cells. The Sculpture itself, real quick, somebody asked about the cost of Sculpture. It varies anywhere from, usually it's around $1,250 per treatment, but you can treat up to 4 areas at one time. So anyways, fat injections, that's surgery, okay? And the great thing about fat is it is filled with stem cells. And I started doing this about 14 years ago, injecting fat to fill the faces out. The problem is that we wrote a paper, one of the first papers on doing facelifts with injections of fat, called the volumetric facelift. And it's a great idea because the face ages in 3 dimensions, and we showed how you can revolumize it. But you take a good idea and doctors go nuts with it, especially out there where in LA, and now you got these people with pillow faces where their faces are huge and pumped up. Oh my gosh. Yeah. So a little fat is a good thing. Too much fat obviously looks bad.
Right. And that's one thing I should say to anybody out there, like, we're not promoting surgery, but if you're going to do surgery, don't go off the radio. Really do research on your doctor. Dr. Youn is ethical. He doesn't do things that aren't necessary. A lot of people are just out for money. You have to be very careful. I hear radio ads every day for a mommy makeover, get a tummy tuck, a breast lift, everything all in one for like $4,000. Don't do it.
No. And that's the problem is that there are a lot of doctors out there who are ditching their chosen professions. They're OBGYNs, they're ER doctors, they're family docs, and they're ditching it because they make more money doing cosmetic surgery. So they take weekend courses. They follow. Nancy says, I'll donate some of my fat.
Nancy, I'll take it.
But they take these weekend courses and they end up putting out their shingle, and they buy ads on radios and on radio stations and stuff like that. Make sure if you're going to have plastic surgery, see a board certified plastic surgeon, a member of the American Society for Aesthetic Plastic Surgery. And that's the cream of the crop of real board certified cosmetic plastic surgeons. And you can find one at surgery.org. So,
2 opinions, guys. Always get 2 opinions, because if you go to somebody, and you're vulnerable, they can give you a snow job and say, sign here, don't do it. Always get a second opinion to see if it's real.
Yeah, definitely. You always want to. And if it sounds too good to be true, it probably is. If you're thinking about any type of cosmetic treatment, it really has to make sense. I can't tell you how many people, Sarah, that I have talked to who they say, oh, I went to this doctor and this doctor said, oh, if I do this, like I saw somebody today, she said, oh, if I do sculpture on my tummy, they're going to get rid of all my, all the fat on my tummy. Well, poor woman, she was probably 60 pounds overweight. She'd had 3 kids. Her tummy was real stretched out. And she spent $1,200 on a sculpture treatment that did nothing for her because it's not made for her. So you just got to be careful. And, on my Facebook page, I try to give people advice of, okay, what is, what is reasonable to do and what are reasonable expectations, because people, they just want your money a lot of times, and you got to make sure it makes sense to you. Okay. There's no magic in plastic surgery. There's no magic in these treatments. They have to explain how it works, see before and after pictures, and make sure that it makes sense to you.
And guys, the reason too that I really like Dr. Tony versus other people is he's so honest, because he went into plastic surgery after his own real experience with plastic surgery. And both of us were talking about how we were nerdy, awkward, younger people. And we really want to help people with feeling better about themselves first and foremost, more than anything.
And I think what you're doing, Sarah, with your site is amazing, because you're getting people to, to look at aging in a funny way and to have fun with it. And that's kind of what I try to do with my patients too. Is like, the fact is we're going to get older. It's just the way it is. And it's okay to get older. And while we get older, why not have fun with it? Because the fact is there are some people who aren't as lucky as us,
right.
and yeah, exactly, and just to be happy with it. And yeah, you know what? If you want to fight it every step of the way, you want to try facials, you want to try do-it-yourself stuff, by all means, do it. Why not? How old are the 2 presenters, Pam asks? I'll tell my age. I'm 45.
I'm 61. I started the page Women After 50 when I was going through my divorce, and I was 56.
Okay, here's a question from Suzanne. How do you firm up muscle loss on my arms? So muscle loss, basically the thing that, R. Anderson says, her site keeps me going.
Oh, thank you. You guys make my day. By the way, those comments you guys send me, I work really hard on my site. It probably doesn't seem like it, but everything you guys write touches my heart. Some days I'm sitting there crying while I'm having my coffee. So thank you guys for joining me there.
You're doing such a great job with it.
So
anyways, arms, how do you tighten up your arms? I'm sorry?
I want to ask you, if people after this go to your Facebook page and they have further questions, can they message you?
What I'll do is, if you leave questions on my actual Facebook page, that's going to be the best thing, because we get so many messages that's harder. But if you leave a comment with a question, I try to answer as many of those as I can. I'll also try to answer as many of these on your site as I can as well. So, but ideally, I'll see them on my site much easier, because I can't check your site constantly. But mine is, we're always checking it.
Okay.
But anyways, real quick, arms. If it's a skin issue of your arms, here's another one. I got to read this one to you. You make it fun to be over 50, Sarah.
Oh my God. Well, guys, I'm over 60 now, so thank you.
And Sheila says you're beautiful.
Oh my God. Thank you, guys. I was having a panic attack before I went on today. Dr. Youn knows. So
Yeah, well, I mean, it's hard the first time, but you're doing fantastic. All right, really quick, arms. So fat on the arms, skin on the arms, it's harder to treat. So skin on the arms are really difficult because to do an arm lift is a big operation, and I don't do many of those because it's such a big operation with big scars. Fat on the arms, you can use treatments like sculpture, like I mentioned earlier, where you can get rid of some of that without actual surgery. If it's muscle that you want to build up, then one thing that you do want to do as you get older, and if you're over 50, super important, is use weights. Okay, ideally you want to try to work out with weights, and they don't have to be heavy weights. But that really can help with your bones. It can help with your metabolism. It can even help with your hormones. And so definitely using weights as you get older becomes more and more important, which is different than what some people think. Oh, I'll just do aerobics and stuff like that, or I'll walk. And walking is fantastic. But if you can, try to use weights as you get older.
I have a question. This was so embarrassing. I was out on a first date with somebody, and I have crepey skin on my arms. And he looked over and it was 80 degrees out, and he said, "Are you cold?" Because he thought it was goosebumps, but it was such crepey skin. So is there anything for crepey skin? Laser, anything?
There isn't a lot. Now, if you are going to go on a date like that and you want to try to get a mild improvement, then there are cellulite creams out there that contain caffeine, and you can use that potentially. That can help tighten up the skin, but it's temporary. The hard part with loose skin is when you're in that stage where it's loose enough that you don't like it, but not so loose that you're going to consider actual surgery, because the non-surgical skin tightening treatments are not that great right now, especially for the body.
It's not loose skin, it's crepey. The surface of it is like scaly.
Thinning of the skin?
I don't know. It looks crepey.
Yeah, what you can try doing
I hope so.
What you can try doing that can help it some is dry brushing. Have you heard of that?
Yeah, I have a dry brush. I don't do it, but I have one.
That may help, because what you're essentially doing is exfoliating that skin. And as you exfoliate skin, that actually creates a cellular signal to cause the skin to turn over more quickly. And that may help some with that crepiness. So, and if people are wondering, what exactly is dry brushing? You get a dry brush. Ideally, you use organic bristles. And
I have one. I'll go get it.
You brush your whole body. Oh, now I'm by myself. You brush your body, and you want to go at it from towards your heart. So you want to go from, we call it distal, or away from the body, towards your heart, towards the lymphatics. And that not only helps with swelling and edema, but it can also help with exfoliating your skin. You do that, you just take a few minutes before you get in the shower. Yep, just like that. You dry brush, then you get in the shower, warm water, and you'll come out and your skin's going to feel softer and smoother. And you may even see some improvement with some of the crepiness. It just depends on the severity of the crepiness.
I've got one more question for you as a man. Like, I think women, we feel a certain way because guys make comments. I know when I was married and I'd wash my face and my husband would see me, he'd say, "You look really tired," because I had no eye makeup on. You guys make pretty good comments at us that make us more insecure. How do we fix that?
You get a different guy. That's what it is.
Thank you.
I got to tell you, I did an interview with a good friend of mine, and she's concerned about the effects of birth control pills on women who don't truly need them. And one of the things that it shocks me, the best birth control and the only birth control that you need is for your guy to get a vasectomy. That's it. And I have seen so many women who come to see me. They say, "Look, I want a tummy tuck because I've had children. I've got all this loose skin and this and that, and I'm going to have my GYN do a tubal ligation." And it drives me freaking crazy, because a tubal ligation is such a more invasive operation than a vasectomy. And honestly, if your guy won't get some balls, honestly, and get a vasectomy, then get a different guy, because you should not be undergoing these types of invasive operations that can create adhesions and other issues. Have the guy get a little snip in the office. It's a local anesthetic. I did that myself. It's no fun, but I don't want my wife to have her belly cut open. It's just crazy.
Tony, you're talking to a group of women whose eggs are on defibrillators and Botox.
Oh, that's true. This is women over after 50.
Yeah, we're not worried about getting pregnant right now. Most of them. Sorry, guys, but most of
Sorry, I went on an aside here. Deborah says, I'm proud of my 50 plus body. Scars, it's life. That's the best.
That's how you should feel.
Yeah.
It's like a picture of our life. And
Yeah.
that's why we're here, just to look our healthiest, happiest, best, feel our best. Like a good diet, it's going to make you feel better too.
Yeah, no, definitely. And so real quick, before we finish, I just want to give a couple of quick diet tips if that's okay. So we talked about sugar. The other thing is ideally you want to add the good fats, okay? And the good fats would be monounsaturated fatty acids. So things like walnuts, like avocados, like olives. You want to decrease the bad fats, okay? Bad fats, we know, trans fats. Saturated fat is controversial right now. And there's some doctors that say that saturated fat isn't bad for you if you have a good diet. But the vast majority of the American diet is not so good, in which case saturated fats are definitely inflammatory. And the other thing is really the number one thing, if you want to think, okay, how do I eat the best to slow the aging process down and improve my health, is add colorful fruits and vegetables, okay? That's what you gotta do. Deborah, real quick, says dark chocolate, please. Yes, dark chocolate is good for you. You want to try to get at least a cacao 70%, okay? So anything less than 70%, like Hershey's dark, not so good. You want to have at least 70% cacao because you're going to get maximum antioxidants. Also, add a glass of red wine, just one glass, not 2 or 3 or 4. One glass of red wine. The resveratrol is great for you. It's a powerful antioxidant. So if you want to have a square of dark chocolate greater than 70% cacao, add some red wine to it, and you have got a dessert that is also good for you.
And guys, Trader Joe's has great high cacao chocolate, really inexpensive, dark chocolate.
Yeah, definitely. Try to stay away from the milk chocolate. That's not good for you. Too much sugar, it becomes bad for you. All that stuff that our kids just got at Halloween, throw that out and go for the dark chocolate instead.
Okay. So I'm going to read the comments afterwards since I don't have my glasses on. I'm so sorry, guys.
And I'm happy I'll answer what I can here. Otherwise, if you head over to my Facebook page, it's facebook.com/Dr. Youn, DrYoun. I'll be answering the questions here, so you should be able to link to that. And I'm happy to answer as many questions as I can get to on my page. And if you do comment, let me know that you came from Women After 50, and we'll enter you into a drawing for a free HFix book. And we'll send it to you free of charge. But just let us know that you've come from there. And if you can follow me, I always appreciate that too.
Okay, great. Thank you so much for joining us. This has taken 6 months to get them here. So
you did a great job, Sarah. That's awesome for your first time.
Oh, thank you. Yeah, I don't even know how to sign off of this thing.
Just press, I think you should see a button there where it says stop broadcast, I would think.
Oh, yeah. Okay. All right.
All right. Hey, thanks, everybody. Have a good night. Thank you so much for watching.
Bye.
Thanks, Sarah.
Thank you, Dr. Youn.
Thank you.